Dr. Nazari, there's lots of information out there, or advertising for that match, where people say one-day implant, instant implants, come in and walk out with a full implant. And yet, most implant doctors and dentists, keep saying, it's on an average of 2, 3, 5, whatever months of wait after the metal stick is put in, so to say, and after you put in that crown and that prosthesis, as you call it, to make it finish. What's your take on this? What's why are there two different methodologies out there? Is there an advancement out there which we don't know about it? Tell us about it. Tell us your feeling about it.
Well, it all depends to the dentist or the surgeon's knowledge, and also to the patient selection. If a patient has lost, as I earlier mentioned, their teeth a long time ago, and they have lost quite a bit of bone, and there is not enough bone to have the implant placed, they need to go through a surgery to augment or add bone to that affected area. So that's the first surgery, and then we need to wait for the bone, for the new bone or the graft to integrate into the body. Then they can place the implant. Those one-day implants or one-hour implants, they work on a very, very selective patients that they recently lost their teeth. On the same appointment, they lose, the dentist pulls the bad tooth and they place the implant in. Or, as I mentioned, they have lost the teeth earlier and they have enough bone and they can put the bone, and it goes into surgical and mechanical aspect, and see that how firm that the screw or the implant can sit inside the bone. We have we have devices that we can measure how tight the screw is inside the bone, and then based on that we can go ahead and replace the missing tooth there the same day. So yes, those techniques are available, and I don't dispute those. And then again, it goes back to patient selection. If a patient has lost their teeth 20 years ago, it's not like a person who just lost their teeth same day or a few weeks ago. So there's a difference.
I see. So there is a place for an instant implant. It could work in particular select situations.
Yes, sir.
Wonderful. And otherwise one goes about having it settled like a foundation, put the metal rod in, let it grow in, let it settle, and then put pressure on it by putting the real tooth on it. Okay?
Yes.
And the people who have to wait, who have no choice but waiting 2, 3, 6 months, whatever it might be due to their situation, is there some, can you put some temporary stuff on it so that they don't look like they just got knocked down by somebody?
Yeah, definitely. Definitely, we have all kind of techniques available to us today that we can send patients home with some fake teeth immediately, or we call them like temporary prostheses, so it will not show that they are missing teeth.
I got it. Okay, good. And during that time, can the person chew at least a little bit on it? Not necessarily, on a heavy, but can you use them a little bit, or does he have to worry of them coming out every minute or so?
No, the patient can go. We educate patients on what they can eat and how they can eat certain foods, like either an apple or steaks, anything tough. We ask him that to cut them into small pieces and then try to chew them on the other side of missing teeth area. But on soft food and anything else, they can chew just fine with those.
Wow, wonderful. Good to know. So basically, there is a new method out there, or there is an advanced method out there where one could possibly, if one qualifies, so to say, which the dentist will determine if a one-day or an instant implant actually fits one. Great.
Yes.
Thanks a lot.